Hey guys, welcome back to Retail Spaces Almost Live. Hope everyone had a good time in the networking lounge and obviously going through the marketplace. We have a really exciting session starting now and even some more sessions to close out the final day here. But before we get started, a couple of things I'd like to bring up. Just once again, I know there's been some good networking, but I just want to make sure that people are realizing that you can send message to one another and request to have some video chats. And if someone's trying to reach out to you, you'll get a little notification on the top right corner. I hope I'm pointing the right way with the mixed camera here. On the top right corner, you should see a little notification, either an envelope or a little bell. Look there, that'll light up if someone's trying to connect or chat with you. You want to miss out if someone's trying to say hello. Also, before we bring up our next speaker, I'd like to use this opportunity to share our Mastermind series, which is kicking off 2 weeks from today. So what the Mastermind series is, these are small group curated discussions focused on specific areas. So our first one, October 8th, is on construction, store design, then we have development real estate, and one for facilities leaders. And what are these? They're literally roundtable discussions just done virtually that we're limiting to 8 to 10 retailers to talk about planning for 2021 and beyond. So typically, again, in a live setting at one of our live events, you'd have the ability to organize these small discussions, which are always the highlight for a lot of people because it allows you to bounce ideas, problem solve, or validate things that you're working on. So we're organizing these, but they are by invitation only, or if you need to request an invite, because we want to make sure that the people are showing up are actually going to, so we can make sure we can curate a small group discussion. So if you'd like to learn more about that, they're complimentary. Just show up at RetailSpacesEvent.com, go to the Mastermind series page, and you can request an invite. And of course, learn a lot more specifically about what the agendas are for each one of those days. So with that being said, super excited that we've arranged to have our next guest join us. He is LB Johnson with Walmart Health. Tried to have him join us at our live event over the years and haven't been able to make that happen. So luck would have us, he accepted a virtual event, and excited to have him joining us on the screen in just a minute. But first, a lot of people are not familiar with Walmart Health because it is relatively new. So we're going to show a short video to explain what Walmart Health is all about.
What if we said the current healthcare industry offers a bad experience? And that for many busy families lacking adequate medical, dental, and vision insurance, it's basically broken. Well, it is. Doctor visits impact everything from time to family budgets to an overall sense of well-being. 1 in 4 busy families worry about the cost of a doctor visit, and at least 1 in 3 don't seek care at all because of cost and complexity. These families need a healthcare transformation that impacts cost, convenience, and care without sacrificing quality. But what can Walmart do to help? We have a vision to deliver a customer-driven care experience that values time, money, and well-being. And how can we do this? By listening to our customers and removing the friction points that keep them from seeking care when they need it. Introducing Walmart Health, a new offering that brings services like medical, dental, and optometry together under one roof. Walmart is proud to bring together healthcare providers committed to delivering a care experience that values time, saves money, and offers a higher level of well-being. This bold vision of solving busy families' biggest care needs also reinforces the Walmart brand promise to save money, live better, by making healthcare affordable, easy, and caring. Multiple same-day appointments will help busy families get more done in one visit, with convenient locations and hours to better fit their schedules. We will build an integrated in-store experience that seamlessly connects all our services under one roof, with a streamlined digital experience that includes easy scheduling and check-ins, plus the goal of transparent pricing, so they'll know upfront what they're paying for the appointment. Providers and our associates will enrich the customer journey by being friendly, respectful, and customer-focused, assuring that customers know they are getting care from people who actually care. And with the convenience of this health center being connected to a physical Walmart store, we can also help busy families get more done on their visit. If we can get it right for our customers by offering affordable, convenient care all under one roof, Walmart Health will help create a better healthcare experience for everyone.
Well, hey, some more technical difficulties, but it's 2020 and this is a new world. We're still trying to figure this stuff out. But thanks so much for joining us. As I mentioned in the intro, I know I've been trying to get you to join us over the years, and I'm glad you accepted this one virtually here, and even with the technical issues. Um, we only got a short time, and I want to jump right into it. But before we get into Walmart Health, and thanks for providing this video to give a little background for the audience. You're VP of Health and Wellness for Realty for Walmart Health, a role you assumed in January of 2019. But can you give the audience just a little bit of career history, LB career history with Walmart and even prior?
Yeah, no, absolutely, Michael. So, of course, 15 years at Walmart. I had the opportunity to join the organization in 2005. Prior to that, believe it or not, I was a finance guy. So I'm kind of a recovering finance and accounting kid. And I had the pleasure of, approaching Walmart and coming in on the real estate side back when we were building out, 300, 350 stores a year on the supercenter side. And the life cycle of the asset is what has really established and prepared me for the journey that we're on today with Walmart Health. The scope and the scale, the size of Walmart, been able to touch pretty much every asset class in every urbanicity across pretty much every state throughout the U.S. It's taught me a lot about teams and recruiting and leading teams that pretty much specialize in what we like to say is bringing simplicity on the far side of complexity. And by far, the health center concept and growing it is going to be one of the more complex initiatives that I've had the challenge and opportunity to lead.
Yeah. So let's get into Walmart Health then. So I currently believe there's 5 standalone Walmart Health centers. Can you explain the format and how they are different from it's the Walmart Care Clinics?
So, and this is how fast we're moving. 6. Last week we opened a 6th in Cartersville, Georgia, and the concept of the notion around the health centers is really to bring access and affordability to the communities that need it the most. We know that we are opening the door to a patient population base that doesn't exist in the healthcare system today. We're seeing a large share of our clients and our patients come in as cash payers without insurance. And we're able to provide affordable services to them in several different modalities, starting with primary care, but integrating that with dental, optometry, behavioral health. We're leaning into physical therapy. And again, we're doing in a way with the proximity of our stores to the communities. I mean, we've all heard we're, 10 minutes within 90% of the U.S. population. We're really able to provide access and affordability that does not exist throughout our country, and help solve a healthcare challenge that's pretty monumental.
Yeah, no, definitely. So what is I guess the plans that are public currently right now in terms of the expansion? So it looks like, Walmart's been moving into healthcare for the last few years, but now it seems like the plan's in place and things are going to be moving pretty quickly. What could the consumers expect to see over the next couple of years?
We started the base in Georgia, and then we'll be expanding into Florida this next year. We stood up a 1 unit in our home base and near Bentonville, Arkansas. Elm Springs, it's about 15 minutes south of our headquarters. Wanted to bring it close to home so that leadership could really touch and feel the health center and give us feedback on how it's transpiring and how it's touching the community. Um, by the end of next year, we'll have a couple of dozen handfuls throughout the U.S., mainly in those states: Georgia, Florida, and Arkansas. But we are planning once we nail this down, and I hope we have an opportunity to talk about our partnership with Blocks. We're really setting this program up to scale in a big way. The challenge is always to beat the last rollout. And as I stated, at the height of the supercenter expansion, we were, 300, 350 stores a year. Our goal, my team's goal, is to double and triple that rate of delivery once we get to scale.
Yeah, so let's get on to the topic of blocks, and we can bring up a little time lapse video to show exactly what we're talking about here. You guys are partnering with blocks based out of Arkansas, I believe, as well, right? To deliver
They're in
modular.
Bessemer, Alabama. Yeah, Blocks is based in Bessemer, Alabama, and they are a manufacturer of medical modular units. What you saw happen there occurred over a 90-day span, but the building itself was delivered to the sites with eight Uber modules, and constructed in 2 nights. So in about 48 hours, we were able to get the base building set. And this was our first one in Noonan, Georgia, that took us 90 days to grand open. We have since dialed that back to right around 45 days, and our target to see everything that you just saw in the time lapse, of course, happen in 90 days. We're going to drop that down to less than 30.
Wow, that's amazing. And I think I share with you, we also produce RetailSpaces. So we've had Chris Giatina, their CEO, has presented at that event over the years. And, it's awesome just to kind of see the progress of that organization, of course, partnering with you guys. So what is your take on that? I mean, obviously the benefits are, the quality and crushing timelines there. Is that something that you see is going to be central to your rollouts for pretty much all of the Walmart Healths?
Well, a big part of the challenge in the commercial industry, don't think we ever really recovered from a supply and demand perspective on labor, on skilled labor. So when you look at traditional construction, as you look to scale a program, you've got that risk of cost increases as you add the demand. Well, this is a manufacturing approach. And as such, the agreements that are struck are more on the procurement side of things. So we anticipate, cost efficiencies as we grow, which, you mitigate that risk from a cost perspective in the traditional mindset. And, the three-legged stool: speed, cost, quality. Typically you give up one or two and trade off for the other. With this approach, we'll be able to deliver all three.
Size of the box. You have 6 centers now and one's planned. What's the average size of Walmart Health?
So the first one we opened in Dallas, Georgia. It may be a little bit monolithical when we look back on it, but that one was about 11,000 square feet. And to understand how we got to that size, my team leads with what we talk about having a product mindset and using and leveraging tactics like design thinking to truly understand and empathize with our customer. And that initial design in Dallas had 4 dimensions of the customer: the patient, wellness consumer, the shopper, and then the medical professional. And we spent quite a bit of time with surveys and interviews and talking with each of those dimensions to understand exactly what, at least initially, that customer segment would like to see in a facility. And it was actually the 5th time that we built. It was version 5, Dallas, Georgia, because we stood up a facility in Bentonville and built a full-scale model inside of a warehouse. We tore it down 4 times and built it back for what you now see as 11,000 square feet in Dallas. Now, since then, we've brought on the partnership with Blocks. And while we feel like we had a really good understanding of those dimensions of our customer and who we were trying to serve, there's also an operational flow and an efficiency that you have to bring to that box. As you know, we see on average 50 to 60,000 customers a week in any given supercenter. So there will be volume and throughput that we need to anticipate for these units. So as we've brought in Blocks and begin to kind of restructure and iterate on the initial design, we've got it down to about 6,000 square feet. And we feel like as we roll out, we'll be between 6,000 and 6,500 square feet.
Wow, that's awesome. So one thing I just want to reference to the audience here now, again, if you have questions, throw them into the chat. I do have one that I'm going to go to in a second here, but that's why we're logged in live here. We can, of course, I've got some questions planned here, but if you have any that you want to throw to LB, throw them into the chat and we'll try to get to them. And one that we have is specifically from Brian D. Poli. It looked like you had to have all subgrade utilities in place prior to installation along with the slab. What else was needed prior to the installation of the blocks? You'd like to ask?
Yeah, so you're talking about the subgrade, and then the beauty of the deployment and the ability to actually have certainty with the manufacturing process is that we have existing infrastructure. So not only are the subgrade utilities and fastenings for setting the Uber module installed, but we're also tapping into the existing infrastructure, electric, plumbing, data from the supercenter itself. So that's another aspect of how we're able to, deliver the speed and the certainty for these boxes.
Great, great. So I want to shift the conversation to COVID. And I know we're all kind of tired of talking about it, so we'll just hit on it for a second. But I'm just curious, yesterday we talked to a number of retailers that shared kind of, how it's had a profound impact on their operations. Specifically, I'm curious to know within Walmart Health, has there been anything that impacted, any of the plans or things that have been accelerated now as a result of COVID for you guys?
So I'll tell you, the one thing that didn't get impacted was the rollout of our health centers. Because we are isolated in the manufacturing plant there in Bessemer, we were able to increase and follow all of the CDC guidelines and safety standards to ensure the health and safety of our associates in the manufacturing facility. And we have not missed a date, despite COVID-19 and all the supply chain challenges that I know many of us have experienced. As far as change, I mean, if you walk into any grocery store or retailer, you see, the plastic barriers. We call them sneeze guards. And as the pandemic began to ensue early on in early March, my team identified an opportunity to really maintain the safety and welfare of the pharmacy operation, from a health and wellness perspective. And we went out over a weekend and developed a sneeze guard that we were able to fasten and roll out throughout our chain, both Walmart and Sam's. And we rolled out those sneeze guards in under 2 weeks, which took the reign of the fastest deployment to all stores since actually 9/11. So it was a pretty phenomenal feat, but definitely a challenge and driven by some of the pandemic issues. The other thing that we're doing on the pharmacy side of things is increasing our contactless environment. So through the use of technology and scheduling apps, customers are able to notify the pharmacist upon when they will be arriving at the pharmacy, and then we'll hand carry their prescriptions out the door so that they don't have to come in.
Great. So another question that came in is, I have a few. What did you learn from the first iteration to the current iterations, and what did you change?
Yeah, and we talked a little bit about this earlier. Operational flows. In Dallas, one of the things that with the multiple modalities, and I hope the video did justice to conveying that, we've got primary care happening alongside dental, happening alongside of optometry and behavioral health, and with all those modalities in one place, the synergies and the cross pollination of those different services will increase the health and wellness of the individual patient. So one of the concepts that we had was to try to integrate and centralize our medical staff. And so if you walk into Dallas and the clinic space, you'll see a large central area where all of the medical professionals kind of huddle. And we call it kind of the huddle space. Um, well, there it is. And
Yeah.
that was one of the things as we brought on Chris and his team with blocks. We found that we could increase our operational throughput by actually taking the professionals and putting them where they actually deliver the services. So putting the medical professionals where the patients would be, and so we decentralized it. We threw out the centralized huddle space for the medical professionals. We actually set up areas where right outside the exam rooms for the primary care suite, and the dental suite. All of our medical professionals are sitting right there, centrally located, where the patients are.
Got it. Great, great. So I'm just going here, and I'm still learning here how to kind of manage the virtual and take the questions here. So I don't want to look like I'm distracted, but we do have a couple of questions coming in, and it's a nice segue because that's what I wanted to bring up next. Is moving on to another topic, it's sustainability. Walmart's been a leader, and I think back, I've been producing events in the built environment for, almost 20 years now. And Walmart has always been a leader with doing things regarding sustainability. Are you using any of the LEED or well building design guidelines or best practices in these spaces? That's a question coming from Christina Sprouse at TD Bank.
Well, as always, at Walmart, we look to exceed expectations. And here recently, Doug McMillon, has announced that, the terminology that we will be using when it comes to sustainability is regeneration, a company that not only sustains but also gives back. And through that, you can see that in the program that we're standing up with the manufacturing approach. We bring in all the materials for these buildings in the raw form. So we're buying raw steel. With the machine, the computers are specifically laser cutting the raw materials for every piece and part that the Uber modules are designed with and designed at zero waste. And then taking that a step further on the regeneration side of things, as you go, if you've ever visited Bessemer, Alabama, the blocks manufacturing facility sits there in a old Pullman rail car plant. And so this community in Bessemer was thriving and was one of the lead manufacturing hubs in the nation prior to manufacturing and steel getting shipped overseas. So to say it lightly, that community is pretty much decimated right now. But as we look to scale, Chris has already done a great job, and we look to and build upon that and regenerating that community and bringing life and economy through the scaling of our program there in Bessemer and bringing that community back to life.
Yeah, yeah, excellent. So we only have a couple of minutes left here, and I just wanted to, take Walmart aside and kind of talk to LB as a real estate professional in the retail space. As we hit on, you've been with Walmart for over a decade, and prior to that, Blockbuster. Retail real estate is going through a major transformation right now. It's no question about it. From store closures, likely seeing a lot of new sizes and new formats. What would you suggest to store real estate, store development leaders, over this next decade? And what do you do with your teams to kind of motivate them moving forward? What do you see the opportunities?
Well, mentioned a little bit the product mindset, and beginning with the end in mind relative to the customer. And Mike, I know you've been around for a while, but in my career, I haven't seen the customer evolve as fast as I have seen them evolve in the last 6 months. And of course, necessity is kind of the mother of innovation and change. And I know a lot of those things are forced upon them, but it is accelerated, especially from a technology contactless point of view, pickup and delivery. Customers just don't want the hassle anymore. And so with our mind's eye, number one, toward being empathetic with the customer and evolving with them. That's number one, and what my team and I talk about all the time, leveraging the design thinking approach so that we keep the customer as the focal point, and not always the process that we need to march through to deliver the goods and services that we all want to manage. The challenges will be unique, as we move post COVID, and we'll have to keep marching toward not necessarily taking the customer or taking advantage of the situations, but keeping that customer at the forefront of every design that we have as we reimagine the spaces in retail.
Yeah. Well, again, thanks so much for joining, LB. I mean, the one thing that we constantly hear from, in all the industries that we work in, when we talk about trying, testing, piloting new things, that's great, but we're just too big to do these things. It's nimble and agile. And I always say that's not true. Look at Walmart, right? You guys are always, it seems that every week there's something new coming out of Austin, Texas. Trying and testing new things from store number 8 to Walmart Health, and just all the different partnerships that you guys have formed over the last few years and acquisitions. What do you say to that, and how do you encourage that internally for the people that work directly for you to try and test new things and not be afraid to take any risks?
Yeah, and I don't know if it's my connection or yours, Michael, but a little bit of breakup there. But I think I get the gist of the question. And the one thing that I've seen, as large as Walmart is, when there are specific challenges and opportunities, what gets us to the other side is, as we talked earlier, simplicity on the far side of complexity is, it's as simple as having an entrepreneurial mindset, pulling out small teams, and having us focus on a particular problem, and not developing a solution that's looking for a problem, of what you don't know. In a space of a large incumbent business, Walmart is done a great job of finding the insurgent talent inside the business, to really push the envelope and challenge measures in status quo, to develop breakthroughs and dynamic changes. And I can say that's part of why my team exists. Now, needless to say, it isn't without trepidation. But as I talk to my team every day, is like climbing that mountain, and we always start at base camp, and we know that the zenith is the goal, but we've got to go through Camp 1, 2, 3, and 4 to get there. And as you move up that mountain, the air gets thinner and it gets more difficult as you make the climb. So it's kind of how we think about it and set our expectations as we move through it.
Well, LB, thank you so much for joining us. Unfortunately, we're out of time. Hopefully, next year we can get you to come to Retail Spaces Live, where we can sit down for a lot longer and learn so much, because there's just so many questions that I have and I know the audience has. But thanks so much for joining us. Apologies to you and to the audience for some of the stream issues that we had here. But wish you well and wish you nothing but luck with rolling out more Walmart Health.
Thank you, Michael. Appreciate it.
Okay. So right now we have the breakouts that are starting. They've already started. We are going to extend the schedule back. We are running a few minutes behind, so we'll make those sessions go a little bit longer. But head there now. We've got 2 breakout sessions going on right now. And bring your questions and be ready to turn your camera on. Okay, take care.